You examine one patient with dengue. Here's the uncomfortable truth. For that one patient in front of you, there are dozens more out in the community you will never see. And if you count only the ones you see, you will get the size of epidemic completely wrong. Let me show you why. Hey medicos, what's up? I'm Dr. Rahul and this is the Iceberg Phenomenon of Disease. And by the end of this video, you will understand it so well, you will never lose a mark on it again. What this phenomenon means and why so many cases stay hidden, these are the things we are going to talk about in this video. So stay with me throughout this video because in the end, I will also tell you the exact keywords, mnemonics for this topic and one MCQ trap your examiner will use. Full notes and question bank are in the description. Join my community on Telegram, subscribe to GM4T Academy and let's go. Just imagine a season of dengue. Your hospital ward is full. The whole city feels sick. But here's the trap. Patients in your ward are not the whole picture of the epidemic. They are only a slice of the disease that got sick enough to reach a hospital. So how much disease is really out there? I want you to think of an iceberg. Imagine an iceberg floating in the sea. The surface of water is what we call the clinical horizon, the line above which disease becomes visible to us. Above the water, the tip. These are the diagnosed clinical cases, the patients who feel ill, come in and get a label. This is what we see and it looks like a lot until you look below. Because below the waterline sits the huge submerged base of the iceberg, far bigger than the tip. This is what we miss. And it is not empty. Below the surface lie 5 hidden states. Pre-symptomatic cases, not yet ill. Subclinical infections, too mild to notice. Latent infections lying dormant. Carriers who feel perfectly fine but still spreading the germ. And undiagnosed cases that simply never reach a healthcare facility. Now, this is what you need to say when asked about the iceberg phenomenon of the disease. The clinically apparent cases, the tip, are only a small fraction of the total disease in the community. The larger submerged mass comprising of the pre-symptomatic, subclinical, latent, carrier, and undiagnosed lie hidden below the clinical horizon. For measles, dengue, hepatitis, COVID, every single patient admitted to the hospital is the tip of many milder or silent infections circulating unseen in the community. One hospital case is never just one case. So why should you care? 3 reasons. 1. If you count only clinical cases, you badly underestimate the true burden of the disease. 2. Those hidden carriers and subclinical cases keep transmitting silently and that's how outbreaks sneak up on us. And 3. That is exactly why public health relies on screening, surveillance and community diagnosis and not just OPD numbers. For your written answer in university exams, the examiner is hunting for these keywords. The tip equals diagnosed clinical cases, the submerged part which equals subclinical, latent, carriers, and undiagnosed. The waterline equals the clinical horizon. Clinical cases are only a small fraction of total disease and the implication, screening and surveillance. Write those, get the marks. It's time for a mnemonic. Can't remember the hidden 5? Let's shrink the whole idea to one word. Plus C. P. Asymptomatic, L. Latent, U. Undiagnosed, S. Subclinical, C. Carriers. Everything below the waterline is a plus C of hidden cases. And now, here's the MCQ trap. The iceberg phenomenon most directly warns the clinician that rule out the 3 wrong options first. Pause this video now. The answer is B. Apparent cases are only a small fraction of the total community disease. A is reversed, C is false because carriers absolutely do transmit, and D is the opposite of the whole point. So, this is all about the iceberg phenomenon of disease. Stay tuned. I'll see you in the next video.